word why. What a curious word. The kind of word that can make us cringe, feel defensive, or even distant. But you know, sometimes why is the key. A key that can unlock so much to our lives. Join me as we explore the why with fascinating contributors to the world. Those that entertain us, inform us, teach us about life, and if we're lucky, inspire the next in all of us. I'm your host, Dr. Rod Berger, and welcome to Headroom, a production of Rainlight and co-produced by Old Soul. Let's go.
Well, for those that follow my work, you know that I get curious about a lot of different subjects and topics and people. And I like to also go outside of my own, perceived echo chamber and or where I reside longitudinally and latitudinally. And so I wanted to talk to somebody in the healthcare space, but someone who's incredibly thoughtful about the world that we're in and the way in which we think about supporting positive experiences in our life. And so this is very important, I think, as we're facing a lot of newness in ways that can be exciting for people, can be challenging for people and families, where there are lots of questions, and sometimes there are more questions than answers. But today we're going to spend time with Dr. Samir Patel. He's a leading expert in holistic wellness, longevity, and optimizing dental health. He graduated from the University of Birmingham, where he received the Centenary Prize and was nominated for the Clinical Excellence Award, and he furthered his postgraduate education at Oxford University in London. Dr. Patel, it's nice to spend some time with you today, and you've been on my mind because I have been thinking about this notion, and this may be very Western of me or even very US-centric, that we are sort of emerging from a world and a time where we look to quick fixes. We look to sort of pat down any challenges we're facing, our anxieties, our stressors, and we just look for a quick fix. And I know that you're much more holistic and thoughtful in the way in which you approach your world and in your life. Can you talk a little bit about your relationship to health and wellness and what are the origins of that relationship when you were a young boy?
Well, Rod, first of all, I am the black sheep of the family. Everybody in my family is a doctor, and I am the dentist. And so I don't know where I start with that, but let me sort of summate. The journey's been very much through, I started in professional sport and then went into dentistry. And now I'm very much in leadership and wellness, but really that journey is telling me we have to evolve. And as my dad was a GP or a doctor for his whole career, that's no longer the case. I think most people will have a myriad of vocations in their life now. And so as we're trying to live older, but really stay healthy as we get older, and that is now an active part that we have to take in that journey. And the earlier you take that actual response to make it active is going to benefit you compound interest in time in your 60s, 70s, 80s, and maybe even 90s. And that is the summation of it. I think I've had huge infiltration of medical people around me all my life. I think that has been a massive aspect of the way I treatment plan in my dental practice. I don't just treatment plan teeth. I think it's the mouth is part of the bigger picture. And there's so many podcasts, so much research now that says it's all interlinked. And I think the yesteryear of individual specialisms have gone, and multi-faculty group people working together in collaboration is now the way forward for diagnostics, but also the wellness program as well.
Is this where we integrate in art into science? We talk about sort of that balance, because I appreciate that you were talking about sort of this notion of specialization and that maybe we're evolving from that to understand it's interconnected. Is that the interesting perspective that you've had and platform being, I mean, in your words, sort of the black sheep of the family, but to see health and wellness from different perspectives where maybe you had a lone spot on that sort of ledge looking out other family members and how they were interacting with patients, the way that they were thinking about developing their own knowledge base. Help me understand that balance between that sort of art and science and the holistic element of your practice.
Yeah, so I think when you look at a patient or you're examining a patient, I mean, there's so many different things about that. The way they walk in, their gait, their mannerisms, their symptoms, and actually then the diagnostics that come on the back of that. You've got to put it all together. You're this detective, and actually just being a physician often isn't the only way you're going to make the diagnosis. And so it is interdisciplinary, as you said. Absolutely, it's interdisciplinary. And I think the more information you have and the longer you have to examine the patient, and in England, we often our doctors have between 10 and 15 minutes for an examination. I mean, that's a really short length of time. And in America, it's the opposite. Let's see what we can manufacture from their insurance to make increase our diagnostic experience, and then the doctor makes the decision. So actually, neither is correct, because how can you be abusing an insurance system to then make a diagnostic decision? How can you make a decision in 15 minutes? Surely it's a longer investigatory understanding of the person, the history, and what their beliefs are as well as understanding what information do I need, and then you proceed to diagnostic. So I think really you've got to have this element that is a mutual beneficial, where you trust the doctor has time with you, and the benefits come with that over a long period of time. It's no longer 2D. We want a 3D, 4D understanding of the patient. As the more you understand the patient and even understand the epigenetics of the parents, the grandparents, I mean, that is where you really have understanding of somebody's true diagnosis then. And so the more information we have, I think that is fundamentally for a physician is very important. But second of all, when we're then looking for things that were short in terms of addition of supplements or whatever that might be, that is what we can then look to augment. So there's such a variety of things we need to look at. You know, how they're sleeping, because that's the core of everything. So I know I'm going a little bit tangent on
No, you're
your
right.
initial question, but that is the bedrock. 8 hours of quality sleep, high REM, a lot of low wave sleep. Let's anti-age within that period. What are we doing in your sleep hygiene that 1 hour before you go to bed? What are you doing to create a great sleep so you wake up the next day with lots of energy, high mental acuity? Your performance at any given task would be far higher. And therefore, you're working smarter, not harder. You're not turning up to work and just working your hours. You're getting stuff done on a really high productivity level.
How do we understand then let's sort of put the patient hat on, because it feels like it takes, I mean, it's that old sort of cliche, right? It takes two to tango. So if you're my practitioner and I'm the patient, I'm a part of your community, maybe not responsibility, but I feel like there's a lack of knowledge, I think, from a personhood to know how to think about a holistic approach to their own health, because of what you were talking about, sort of this yin and yang. I mean, we talk about the British system and the American system. How can we help to support so that people of all ages and all backgrounds can have in essence, a better relationship with their own health? Because this is that sort of reactivity versus proactivity. I mean, that doesn't even take into account sort of those that share our gender, where classically we don't pursue answers because whether it's shame or any number of reasons, where men and boys don't go to a doctor to get ahead of something. They wait and sort of hope that it doesn't transpire over time, or that their greatest fears. But it's about sort of that understanding, that education. Where are you, or how can we improve that so that the patient in general can take a proactive and supportive? To me, it's about supporting your mind and your body in a way, in the way in which you think. You're talking about sleep hygiene and how you set yourself up for success. Well, that says to me, you've got to care enough about yourself and feel confident in what you know to be able to ingrain those practices on a repeated basis over time.
Yeah, for sure, Rod. That proactive word is so important. I think even if we look back 15 years ago, dentistry, medicine was all reactive. And actually we're moving, and you can feel that transition of proactive healthcare now starting to take place. And there's so much information out there, whether it be podcasts, books, whatever information is out there. I think one thing you've got to understand is that you have to understand your body, because what works for you is very different from what works with somebody else. And overthinking it, and the amount of books we read that tell us we need to get 8 hours sleep, like if you're not getting the 8 hours sleep and you're still putting something in the way of getting 8 hours sleep, it's really going to affect you. And so you've got to understand your body. You've got to understand when you feel you can work out, when you feel your body needs a break. Our body tells us all of this. It's about listening to your body and understanding the days that you feel great, yep, let's go for it, or the days that you don't feel so great, and saying, actually, I need a break here. But let's not put any boundaries in the way of still getting out of bed and doing that workout in the morning, if that's when you do it. And I think, evidence does show most people do work out well in the morning. So let's have the trainers ready, socks inside the trainers, and whatever it is that you're wearing to work out, let's have it all ready the night before you go to bed. Let's not put any barriers in place. And so I think that proactive element of being healthy is so critical. And so nothing is a substitute for that. And your body is the best computer in the world. Whatever you put in your body is what you're going to get out of it. If you're putting positive energy in, you will absolutely smash it. If you're a negative person, lots of negative things are going to happen to you. It's just the way it is. So actually, let's restart and say, look, this is my human body. This is my computer. I'm going to treat it like an absolute legend. And I'm going to fuel it with lots of water. I'm going to eat well. I'm going to eat healthy. I'm going to eat at the right times. I understand eating before I go to bed is going to affect my sleep. So I'm not going to have my phone within touching distance within an hour of going to bed. I'm going to have that warm shower to align all my atoms, which is 70% water, back to the resonation of where they should be, vibrating at that right vibration that is just you. And then a fiction book or something like that, just to get ready for the day. And then you wake up in the morning, you'll be fresh, you won't be yawning, and you won't be taking the cancer products like Red Bull or things like that in the morning to get you going.
Tell me about was there a moment, and this may not be you, but this is just sort of an observation that I think as humans, when we are, whatever area of practice we're in, sometimes we are the worst patient for our own expertise, right? We sort of overlook the need to do the very thing that we help others, whether that's even, fixing cars. I mean, it doesn't matter sort of the discipline. Was there a point or a flash point in your life when you realized this wasn't just about working with patients or working within your discipline? It was also about your own journey of health and wellness. Was there a pivot point for you? I know you've gone on some personal journeys of exploration, the Himalayas. I mean, you've had these really, I think, fantastical experiences. Was there one point when you said, yes, I want to partake on this for myself?
Yeah, 100%, Rod. I think the inflection point for me was in 2017. And I'd been a dentist for just over 20 years in healthcare. And I really felt my body was telling me, you need a break. And I'm one of these guys, Rod. I get up at 5:30, 6 o'clock. I'm jumping out of bed. Can't wait for the day. I love my work. I love spending time with my family. I love everything about life. And my body was just telling me, you need a break, pal. And so I had 3 months off, and I spent those 3 months. It was 1 month was in the foothills of the Himalayas, learning Ayurveda, yoga, and meditation. 1 month was at home with no WhatsApp, no emails. And I had 1 month knocking everything off my bucket list, which was golf camp, cricket in Australia. I mean, lots of fun things, diving. But really, that is the way I structured my sabbatical. But that 1 month in the Himalayas taught me that life in medicine is not black and white, which is what we're taught at university. This is what it is. This is the diagnosis, what you got to do. It taught me that there is a wide variety of medicines that are available, from traditional Chinese medicine to Ayurveda to traditional medicine. And I think everything has a place. So therefore, I understood there was gray. And when you then understand there's gray, I think you can start to treat a patient a lot better because you're sympathetic for that patient and you're active listening as a doctor. And you're not absolutely looking for a diagnosis as soon as the patient starts talking. You're actually just sympathetic at what that person's going through. And therefore, on the back of that, you then understand, okay, well, there are a wide variety of treatments here. And let's start with the simple ones. Let's start with you, and then followed by you. Let's then figure out what I need to do. Let's take a simple example of gum disease as a typical example. I think over 60% of patients have, or people in the population have bleeding gums, which says that you've got gum disease. The first thing you've got to do before you actually give them a scale and polish or do some deep cleaning is teach the patient how to brush their teeth. And this is the way you brush your teeth, and this is how long you've got to do it for, and you've got to do it twice a day, and you brush before you have breakfast, and then you brush last thing at nighttime. And then when you go to bed at nighttime, maybe leave a little bit of the toothpaste on your teeth. It'll really remineralize it. Like, there is so much in that. And so once you've done that, they often turn up 2 to 3 to 4 weeks later, and they almost have no gum disease, and you don't need to treat them. Because actually a lot of the work can be done by yourself. It's just education. And so that's the simplest way of understanding that we can treat ourselves and human bodies in an incredible way. We have an incredible way of treating our own bodies.
Did you find that inflection point, that sabbatical that you went through, did that change the way in which you thought about? See, for me, I think about the story, and that's what's really so interesting to me. It's sort of the underbelly of what you're talking about. Because if you're there with a patient who has gum disease or whatever it is that ails them, what I'm hearing from you is there's a resonance, there's a connection of the energies that you're sharing with that patient. And through that, they feel connected. There's a trust that develops. And now whatever you're educating them on, they can put into practice. Did you find that your ability to ask more thoughtful, more connecting questions was one of the results of your sabbatical, in a way to understand the person in front of you in a way that maybe you hadn't when you were going through your training and your clinicals?
Yeah, I definitely think I learned to actively listen better, no doubt. And also the point that you made, I think once I started treating this way, patients like that were searching me, and the vibration of my energy and what was going out and the way other patients were being treated, I think we were getting a lot more people interested in wellness, not just dentistry. And I think that's across the board for all the physicians I know in medicine and dentistry, that as soon as you start treating like that, it's different. You start treating the patient and not the symptom or the problem. That is just a different way of treating a patient. And it's that mutual sort of benefit that you get, and benefit is really the word. As soon as you start trusting each other, and a patient comes in and you're doing surgery, can you imagine the patient is saying, Samir, you've got it. I'm just going to leave it with you. I'm going to just go to sleep. And then how does that make me feel? And just think of my performance level as like an elite athlete before I started dentistry. Like, that's amazing. I'm going to perform. I know everybody's telling me I'm great. So I'm going to go out and perform. I'm not fear driven. And now I'm in a dental practice where my patient's telling me, Samir, you got this. Thanks so much for looking after me. My energy is so relaxed. I'm giving the best that they can get from me. And it's just a great environment to be in. Patient's happy, I'm relaxed. And I think that is where we talked about 3D, 4D with patients. That longevity of understanding your physician is really important. And them understanding you is really important. And chopping and changing is not good for anybody. But you want somebody that understands you and wants that proactive element of being healthier and understanding what your visions are. Because if you're somebody that wants tablets, this is not your vision. This is not where we want to be. We want to get everything right from the primary source, first of all, and you changing what you can before you start taking tablets.
See, that resonates with me. I remember when I had surgery a few years ago, and I was sort of touring and meeting different surgeons. I picked the surgeon that connected with me the best. And the ones that were transactional, that felt very transactional, didn't resonate with me. And I thought, that's not who I want. You know, I want someone there that if something goes awry, that connects with me in a way that, you know, and that was a personal choice in that regard. But as you were saying that I think that speaks volumes in the way in which we need to be thinking about our relationship with our health and the ways in which we approach that. Now, I know that you're a father, and what I think is fascinating for those that are continuing to grow in their knowledge and expertise in longevity is when we think about sort of the parent hat and the way in which we think about our children growing up, and how this might have impacted the way in which you thought about setting your children up for success. Can you talk a little bit about that role? Because I think that whenever we put on our parent hat for those that are parents, I think it does change a little bit because we're looking out for them in a way that maybe we don't even for ourselves. How have you been impacted through your journey and being a parent?
I think the first thing that when you're a parent, it's so exciting. And, you know, it's a journey that is full of love and it's unconditional love. But actually, the thing I've understood now, I have from a 15 to 9-year-olds, and the place where you live and the people you surround your kids with is really important because it creates safety, it creates aspiration, and it creates a benchmark of how they should be. And then the second part, which I think is fundamental, is that it's often not what you say, it's what you do, what they see. And actually, we can badger them to death, but actually it's not that they take away. It's all the things that you're doing, the hard work, the fact you're ecocentric, the fact you're looking after your own body, you're working. That is what they see. And they will then replicate that in years to come as a default. And that's what they teach hopefully their children as well. But everything else is all about love with these children. You know, I just don't see enough love from parents, and it's transactional. I've got a kid, I've got 3 kids, and I'm off to work and I'm going. And there's just not enough love because everybody's busy. Now, in most families, 2 parents work as well. As in my family, you know, we both work. But I think you've both got to identify when you can have a little bit of time out, or you're not as engrossed with work that you need to be fully immersed with children. And so on a weekly basis, I try and make it a point that I get 20 minutes with each of my child, and just not asking them any questions, just being.
Sharing space.
They share some incredible stuff about the week that you just cannot understand. And I would have never got it out of them with any of my questions. And I reckon I'm really good at asking these cunning questions to get stuff out of people. But just 20 minutes a week, figure it out. They'll purge. They'll tell you all about their week or their things that they're bothered about. And, you know, one thing that my wife and I do with our children is sometimes we go away with our children individually, just one adult, one child. And we found that really increases the bonds and the understanding of each other, not only my values and my wife's values, but also what that child is all about as well. And so it may not be that everybody can do that, but just a short amount of time with the children is just a unique place where they can understand what you're all about, and hopefully you can have some impact on them. But I think fundamentally, we're trying to also set a benchmark of being healthy and looking after your body at a young age, because that's what we're trying to do. For sure, it's what I'm trying to do in my life of staying healthy, staying fit, staying curious, and trying to be a child. As you get to know me a bit better, Rod, you'll understand being a child as much as possible, and playing some practical jokes when I see you will definitely be order of the day.
I love that because we do the same thing with our kids, and I appreciate that you said, you know, not everybody might be able to do that, but you're right. I mean, like, I drive my kids to school each day, and I drop them off at different campuses, and even just those 20 minutes, that 15 minutes, just to chat, just with one of them, Or we'll call it like date night. I'll take my daughter out on date night, and it's like, what do we want to do? And it doesn't mean that we're doing anything of like significant sort of substance. It's just that we're going out somewhere together that she's chosen. And you're right, it is that experience, because we're seeing more and more the anxiety, especially in the U.S., of young people. And I do wonder how they will think about the care of their own body and their own sort of lifestyle as they march into adulthood. And that leads me to, I know that you are collaborating with NØØT. Can you talk a little bit about NØØT and the ecosystem that is being built under the umbrella of NØØT? Because to me, it's not about, we talked in the very beginning of our discussion, sort of this proactivity or reactivity, right? Sort of the Band-Aid approach that people have grown up and are used to. This is a different sort of approach. This is understanding all facets of our day, of our life, and doing so in a way where there is some level of control that we have, which I don't think you can say lightly, because I think for many, it's felt like their own health is not in their control. But I think through an organization, through a community that NÜİT is building, that is something that can be achieved.
Yeah, I think for a while now, I've understood that good food alone is not going to stock your body with all the vitamins and minerals you need. Our over farming, our soil is undernourished now. And so when we talk about nutrients and supplements, I think it's really important to understand that it's an augmentation, as we've mentioned earlier, to what it is that we're trying to do for ourselves. And we're trying to live longer, but be healthy at the same time. So that there's no substitute, by the way, in terms of supplements and working out and being healthy and going to the gym on a regular basis and movement and rest and all the rest of it. There's no substitution for this, because this is the controllables. Where we're struggling in nutrition in today's world is that there's just not enough good stuff out there. And so we need to augment our vitamins and minerals and supplementation with something. And so historically, we've had products and mass-produced supplements that are, quite dangerous if you actually look at what's in them, and they've not been regulated well enough. So what I would urge everybody to do is have regular blood tests, because that's like doing just an MOT for yourself, like your car does every year. Have an MOT, understand where you're at, where your blood's at, what's high, what's low, what's moving in the wrong direction. Start to get an understanding of this three-dimensional image of where your body's tracking, and really start doing some tests on yourself in terms of your VO2, your cardiacs, all the rest of it, just to understand where your body is moving. Are you moving in the wrong direction quickly, or are you staying stable, which is what you want to do, or get stronger? And we know as you age, sarcopenia is going to be one of the biggest things that impact all of us, and the amount of muscle mass we have. So when we talk about nutrients, we're talking about augmentation again, and understanding what is the science behind an effective dose to allow us to get the right supplements and the right nutrition to be able to function at the highest level. Because basic elements are needed for so many processes within our system. Formation of hormones, neurotransmitters, muscle mass, growth, all of these things are so important. So what we're trying to do is enhance what it is we're trying to achieve with latter years. And so I don't think there's a replacement for good nutrition. I just think that there isn't enough good stuff in that nutrition that's coming through. And so when you look at it from a building blocks point of view, I think you've got to understand your nutrition is very important to your body. And then once you have that good nutrition and you've got your blood tests, it's about augmenting to that. But as we age in life, a lot of the problems are inflammation. So it's keeping the inflammation down and understanding what it is that's creating the inflammation within those individuals, whether it be you or me. We have huge genetic differences. What's going to cause that? What's going to make that the pistol fire? And it's going to be different for all of us.
Because it's compounding, right? I mean, these things compound over time, to your point around inflammation, and that I think that there's this notion that we're always seeking a magic pill or something. We're seeking some magic solution. But throughout this conversation, really one of the things I'm taking away, it's about intention. It's about sort of lifestyle and understanding. You're talking about like sort of a supercomputer that we are, and that, you know, sort of what we do maybe in the morning will impact us at night and vice versa. And the time that we spend with people. So it is that holistic element. Is that the beauty of NØØT for you? Because you are such a thoughtful person. What was it for you that you said, this is a group and an organization that I want to be a part of, that separates them from maybe other opportunities that you've had?
Yeah, NØØT is just something different that I believe is a better product than most. That's the first thing. It's evidence-based. The quality is incredible, because if you can think, you're eating a vegetable or a fruit, and you think of where everything's released, it's in the smaller and large intestine. It's not got to be early. A lot of these allow everything to be released bioeffectively. And so the thought process and the quality of the ingredient is the level of granular thought on this is really incredible. And Dia, who's in charge of this brand and community, is doing such a great job to, first of all, source great ingredients. Second of all, understand the evidence base behind it. And third of all, create a community, and I'm proud to be associated with that, to allow all of us to collaborate, because that is where the magic often happens, in the community, in the collaboration. And so what you're finding is that the level of quality in these products is just not the norm. And so when you're buying your supplements, you're buying your augmentation pills, I call them, look very carefully at what's in them. And I'm not here to tell you to buy NØØT or any other product at all. I'm just telling you that this is a product that I believe is safe, and I believe is really at the forefront of where supplements should be. And I'm really excited in the journey that we have ahead of us.
I'm going to take a wild guess that you were saying in 2017, as you were thinking about your sabbatical, because your body was sort of saying you needed a break, that you're at a point now in your life in 2025 where it's not about taking a break, that you are embracing it. Like I genuinely sense this sort of childlike excitement about where you are, and just understanding yourself as a parent, probably as a spouse, and a community member. Is that a fair assessment from me?
Yeah, everything's super exciting for me, Rod. It's, you know, and this is just one of the things I'm involved with at the moment, but this is really, I think this should be now the norm of the way supplements are produced, and people should be looking very carefully at the supplements that they take on a day-to-day basis. I just don't believe mass production of supplements is the right way to go. We've got to be really careful. I just don't think there are tight enough laws in America as well. I think we're better in the UK. But I think overall, the quality of the product and everything you're putting in yourself, which is, I think, a lot of the conversations we've had, the nutrition and whatever you're putting yourself in, be aware of what you're putting in your body, because it's so important.
Well, and it's a reason why, I mean, like I was saying earlier, that for me, the underbelly of what we're talking about, it's inherently story. And so, you know, and in being transparent, that's why I'm now a part of the NØØT community, because I have been blessed to be able to capture stories near and far and in very remote parts of this world. And I'm always struck, Dr. Patel, that I can get back on a plane from a remote part of Africa and think to myself, the very challenges that a grandmother had in a distant village, they're very similar to the challenges of someone that I just met or interviewed in Cleveland, Ohio, or in Ontario, Canada. And so just from a humanistic perspective, there's so much that we share, even though it seems like we look to separate and identify and categorize, and yet we're all so similar, and we battle many of the same things. And it's about understanding those stories and the ways in which we can help collaborate. I'm so glad you said collaborate together on what tomorrow can look like. We want to thank Dr. Samir Patel, and you can go visit NØØT, NOOT.us to learn more about his work and the community that he finds so dear to him. I'm your host, Dr. Rod Berger.